Micro-osteoperforations cause a localized inflammatory response, increasing blood flow and cytokine. By increasing the cytokines in the area of desired movement, bone remodeling activity greatly increases, and therefore the rate of tooth movement increases as well. While applying any type of orthodontic force, micro-osteoperforations harness the body's own biological response to increase the rate of bone remodeling. The Propel device can be used in conjunction with any fixed or removable orthodontic appliance to treat a multitude of different malocclusions,